A woman suffering from mental illness brutally murdered her own 3 children. Extremely dangerous, so they must find her to prevent harm to others. Tom requested to investigate this case because his wife and 3 children were burned to death by a criminal. But the criminal avoided the death penalty due to mental illness and was confined to this mental institution. Yet all he knows is the enemy's name is Jack, nothing else. So he wants to find Jack to avenge his wife and children. Soon the two arrived on the island. The warden had been waiting for some time. The guards were very tense. Tom figured it was because of the patient's disappearance that security measures had been upgraded. Sure enough, before they could enter, the warden demanded to confiscate their firearms. Tom said they were federal agents with the right to carry weapons during investigations, but was flatly refused by the warden. Either hand over the guns or go back where they came from. With no choice, Tom had to compromise. The warden told them, "This place is divided into 3 areas, A, B, and C." Tom could freely access the male ward in area A on the right and the female ward in area B on the left. But Area C in the back houses the most dangerous criminals, requiring permission from the chief physician, and can only be entered with the warden's accompaniment. Tom indicated he understood. Then they entered this special hospital. The patients here all wore shackles. Some greeted Tom very friendly and warmly, but others were extremely nervous. And this eerie woman made a shushing gesture at Tom, then smiled eerily, making Tom feel there must be a huge conspiracy hidden here. Scene transition. The warden brought them to the chief physician's office. Upon entering, Tom was attracted to the paintings on the wall. These paintings depicted physical therapies for treating mental illness.
As if whipping them bloody would drive the psychosis out, we drove screws into their brains, we submerged them in icy water until they lost consciousness or even drowned.
The doctor also said, just a few years ago, a physical therapy involving frontal lobotomy won the Nobel Prize, becoming the mainstream treatment method. The doctor began introducing the missing patient Lisa's situation. She has severe delusions, living in her own fictional world, believing her children are still alive, and treating the prison as her own home. In her view, guards, doctors, and nurses are delivery men and milkmen. She usually behaves normally. No one knows why. She mysteriously disappeared at dawn the day before. Looking at Lisa's photo, Tom's head suddenly began to ache severely. The doctor quickly got Tom some painkillers. After the headache symptoms eased, Tom went to Lisa's room. The windows were sealed shut. Guards outside, patrolling 24 hours. You could say it's an impenetrable fortress. Jerry took out 2 pairs of leather shoes. And prisoners here only have 2 pairs of shoes, which means Lisa didn't even wear shoes when she left. You must know the island is surrounded by sharp reefs. Leaving barefoot would be impossible. But Tom didn't seem to notice. These were both man's leather shoes, because his attention was drawn to the floor, where he found a note underneath. It read. Seeing the note, the doctor became very nervous and tried to snatch it from Tom's hand, but Tom forcefully kept the note. Obviously, the doctor is hiding something.